Hello everyone, I am Dr.Prachee Kulkarni, fertility specialist, Ferty9 Fertility Center, Banjara Hills. Today I'll talk about the causes for depletion of egg reserve or low egg reserve in women. So the most important factor is the age of the woman. As the age increases, the egg reserve starts declining. After 40 years, it becomes very difficult to conceive with your own eggs. So it is better to plan your pregnancy in your late 20s or early 30s. If not, at least you can consider the option of egg freezing. Now coming to the second factor, which is also related to your family history. If your mother has early menopause, like in her late 30s or early 40s, then there is a risk that you may also deplete your egg reserve earlier. So in that case, you should check your egg reserve by consulting a fertility specialist and getting an AMH blood test and ultrasound of pelvis done so that you can take action in time. Other reasons which are related to genetic factors are there are certain genetic conditions like Turner's syndrome, fragile X syndrome, which deplete the egg reserve faster. These genetic conditions have problem with the number of eggs in the ovary from the birth time. So such patients will have maybe delayed onset of their first menses, what we call it as menarche. So first menses is late in such women, like after 15 years or 16 years of age. They tend to have shorter cycles and they tend to deplete their egg reserve sometimes even in their late 20s or early 30s. So if you have shorter cycles, then get yourself investigated to know your egg reserve. Coming to the medical conditions which may affect your egg reserve. Medical conditions such as diabetes, hypothyroidism, which is especially autoimmune condition, can affect your egg reserve. Other autoimmune conditions like SLE, rheumatoid arthritis also can deplete your egg reserve faster. One reason can be because of the autoantibodies which are present in those diseases can damage your eggs. Also, sometimes the drugs which are used to treat these conditions can reduce the egg reserve. Then coming to the other cause which can deplete the egg reserve is certain cancers. So cancers by itself can deplete the egg reserve, or also where the cancer treatment, especially if it is associated with pelvic irradiation, pelvic radiotherapy, it puts your ovaries at risk of radiation damage. Also, certain chemotherapeutic agents which are used for chemotherapy of certain cancers can affect your egg reserve. Such patients who are young and diagnosed with cancer requiring pelvic radiotherapy or chemotherapy, they are advised to visit fertility specialists and do their egg freezing before they take their chemotherapy or before they take their pelvic radiotherapy. So these are multiple conditions, medical conditions which may affect your egg reserve. Now coming to the surgical conditions. Any surgeries which is done on the ovary, like for removal of ovarian cyst or endometriosis, or even certain ectopic surgeries also can deplete your egg reserve earlier. So any ovarian surgery, any pelvic surgery may affect your egg reserve. So if you have undergone any ovarian surgery, get yourself tested. Now coming to the last but the least, lifestyle related issues. Lifestyle related issues like smoking cigarettes can deplete your egg reserve faster. Even passive smoking is not good for your egg quality and egg number. Drinking alcohol can affect your egg reserve. Also, if your weight is on the higher side, then it may affect your egg reserve and deplete your egg reserve faster. So it is important to maintain a healthy lifestyle with balanced, nutritious diet, which is rich in proteins and antioxidants, regular exercise, and also avoiding smoking and drinking alcohol. All these factors will help you maintain your egg reserve. I hope this was helpful. Thank you.